How do you manage a transfusion reaction? Hi, it's Dr. Fan here. Let's talk about blood transfusion reactions. Giving a blood transfusion carries many risks. These can be divided into infections and transfusion reactions. When discussing infections, most people think of blood-borne viral infections such as HIV, hepatitis B, hepatitis C, and West Nile virus, all of which have a transmission risk of around 1 to 3 per million. However, infections also include acute bacterial infections from contaminated blood, which may cause acute fevers and sepsis, and present similarly to transfusion reactions. Transfusion reactions can be divided into major and minor reactions. Minor reactions include acute febrile reactions, allergic reactions, acute pulmonary edema, and transfusion-related lung injury. Major reactions include the severe ABO incompatibility and the less severe non-ABO incompatibility. These are dreaded reactions that can be acutely life-threatening. These reactions cause hemolysis and have a classic triad of symptoms being fever, flank pain, and the passage of red or brown urine. Haemolytic transfusion reactions can be due to incorrect sample collection, an incorrect product being given to an incorrect patient, and non-ABO antibodies from previous transfusions and pregnancy, as well as lab error. However, due to the serious nature of these reactions, a number of strategies exist to prevent such hemolytic reactions from occurring. These include requiring 3 points of identification being name, date of birth, and hospital record number to avoid misidentification. Requiring all details to be handwritten onto the collection tube to avoid the mislabeling of tubes. Requiring double signatures on the forms and tubes as an additional checking process as by a second person. And requiring recollections of cross-match requests if any of the above are inaccurate as a zero tolerance policy to error. These checkpoints are effective but not infallible, and the overall incidence of acute hemolytic reactions in Australia is about 1 to 4 per million. So, what can you do if you notice your patient having an acute hemolytic reaction? There are 2 things to consider. Number 1 is the acute management of hemolytic anemia, but equally important is number 2, the administrative management of addressing this unexpected but preventable adverse event. The sequence of steps in management should be as follows. 1. Activate a rapid response call-out to get extra help early. The rapid response should also notify the anesthetic and intensive care unit teams to attend. 2. Immediately cease the transfusion and discard the transfusion line. 3. Manage the patient according to the ABCDE principles of managing airway, breathing, circulation, disability, and exposure. Specifically, in terms of circulation, a new line needs to be inserted and used for resuscitation of intravenous fluids to avoid further contamination. 4. Repeat the cross-match. 5. Send off lab requests for venous blood gas, full blood counts, electrolyte urea creatinine, and coagulation profile. This is needed to assess for any end organ dysfunction. 6. Transfer the patient to ICU for ongoing monitoring. 7. Consult hematology for advice. Specifically, consider the use of corticosteroids. 8. Support renal function and correct coagulation abnormalities. It is important to note that the haemolytic process is not reversible. The main focus of management is to support the patient and manage any end organ dysfunction. Having completed the acute patient management, it is now time to move on to the administrative requirements of dealing with a severe adverse event. 1. Check that the product administered was indeed intended for the patient. 2. Inform all relevant stakeholders of the incident, including the patient, admitting officer, blood bank, and patient's relatives. 3. Log the incident through the hospital internal incident management system. These systems may differ across different hospitals, so it is advisable to know the process for your hospital. 4. Clearly document all events in the patient file. 5. Present the patient in the next morbidity and mortality review for formal discussion. 6. Perform an audit in the use of transfusions in the hospital. And this is how you can manage acute hemolytic blood transfusion reactions. Thank you for watching. If you like this video, please like, share, subscribe, and comment for more videos.